That pain that you feel in your knees, it's not your knees. That's not the source of your pain. They're just reacting. They're reacting. Let me just fix this. Something's going on here. Your knees are reacting to other areas of the body that are weak or that are tight or stiff. And when they can't function like they need to, then they might hurt. But we don't always need to blame the knee. It might be going on somewhere else. So I'm going to do a couple of tests here with you today so you can look a little broader to determine the source of your knee pain. And a lot of times it's more than one source. And we really address the whole leg all the way up to the hip. We address the core. And sometimes we have to go even further. We're going to talk about how we need to assess all the way up into the inner ear and into the brain as a possible source of your pain, that reaction of the knee to something else going on in the body. I'm Stephanie Carter Kelly, a physical therapist that uses yoga in everything that I do. And when we go all the way up to the brain, it's that investigative process. It's a good examination. I'm going to give you some hints here. But if anything here shows to be positive, that's when I highly suggest that you see a physical therapist. They are going to do a full examination to really determine what is the source of that knee pain. And if your physical therapist just focuses on the knee as the source of your pain, that's not a good examination. If they're only looking right here and they don't look at your ankle, they don't look at your foot, they don't look at your hip, if you tell them, yeah, I'm sometimes dizzy, and they don't look at your inner ear, their vestibular system, that's not a good examination. The goal of a good physical therapy examination, because we have the luxury of having more time and a really good understanding of the entire movement system, is that we're going to look at it all. We should be looking at it all. I know this because I taught physical therapy for many years. And so I'm trying to explain to you as the consumer who doesn't know all of the ins and outs and the details of the anatomy and the physiology, but you need to go armed in understanding what is a good examination. A full, broad body examination is what you need if you're having troubles. If you're not getting answers from one therapist, go to another therapist. That's my soapbox for the day. So I'm going to give you a couple things to check. So in a lunge position, I like bringing a couple blocks out for a lunge position. And you bring your foot out in front of you. The blocks are nice. I'm going to keep them way and far in front of me. You might not want them right at the foot, but I'm going to bring them out far so you can see what's going on. This position, how far can you really lunge into this position? And this will give you information about two different areas of the body. One is the ankle. Can your knee go out over your toes? And I like to take the block and set it up. If you set the block up right at the end of the toes, your knee should be able to go out past the block. If you have a shorter leg, I understand. But that's the distance that we're trying to go. You want your knees further than your toes by about 4 inches. So that block is about that distance. If you can draw a line, I'll give you a better visual description. If you could draw a line down in front of your knee, it should go quite a distance out in front of your toes. So your ankle, the mobility of your ankle, has everything to do with what you feel in your knee. You need ankle mobility. Your heel needs to stay down and you need ankle mobility. And sometimes I even kind of force that ankle down as I stretch. So this is as much about getting a nice deep ankle stretch. Now, your knee might not tolerate this. It doesn't want to bend this much. But there are other ways to stretch the ankle. This is a nice assessment. The other thing that you're assessing in this position is the front of your opposite hip. And so we're going to do it both ways. But the tightness in the front of the hip, either same side or opposite side, can absolutely play a role in the function of your knee. That knee might have to work hard. It might not be able to go through some of the subtle rotations and movements that it needs to go through if you have stiffness above and below that knee. So we'll just do the other side. Same kind of thing. You want to assess both sides. Shift the weight forward. I'll give you that same description. And you want to just look to see if there's an imbalance side to side. Does my body function the same on one side as compared to the other? Sometimes the imbalances side to side don't play into the biomechanics. Sometimes they do. But it's interesting to just be aware of any imbalances that you notice in the body. So that's the ankle assessment, looking to see if that knee goes out over the toes. And then what do you feel in the front of the opposite hip? Now, the front of my right hip might have everything to do with the function of my right knee, but it could also affect the function of my left knee. So that lunge position is a really nice way to assess the ankle and the hip. And the knee is going into a lot of motion, so you have to have that knee motion and be able to do that. But it's a nice way to stretch all those things, ankle, knee, and hip. So you can use it as both an assessment and also as a stretch. So the other one, you're going to come stand by the wall, or you can hang on to the back of the chair. So we're just going to assess your ability to hold your balance. So I'll just use the back of the chair so I can face you, but you can face any direction. It doesn't matter. There's a really simple test that we use, and I like to tell people to hang on to something. You're going to stand on one leg, and then you're going to raise your hands off, watch the clock. You want to be able to stand on one leg without touching down with the foot, without touching with the hands for 30 seconds. Eyes open, 30 seconds. And so you can kind of watch the clock and do that. You want to test the other side. Do you have that ability to stand on one leg and let go and hold for 30 seconds? Hold your balance. If you can't hold your balance, there's several reasons why you can't hold your balance. It could be weakness of the leg. It could be that you haven't done this or challenged the leg, so the nerves don't really tell you where your body is in space, the proprioception. There's, we're going to test this in a minute, but your eyes, your ability to sort of focus and hold your balance that way. And then there's the vestibular system. So if you have difficulty holding your balance, it might be a good indication that you need to work on your balance and that your knees, your ankles, your toes, your hips, your whole leg, but maybe you feel knee pain, is reacting to something that's going on far away from your knee. It could be more inner ear, it could be vestibular system, but it doesn't really have anything to do with the knee. The knee just takes the stress because it's trying to hold you. So we did 30 seconds on each leg. Now we're going to do 10 seconds on each leg, but you have to do it with your eyes closed. So you hang on, you close your eyes, you let go, and you start counting to 10. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 7, 8, 9, 10. I didn't quite make it to 10. Let's see if I can do the other side. So close the eyes. Make sure you have your balance. Close the eyes. And this really, when you take the vision away from holding your balance, then you're really assessing the proprioceptors and the vestibular system. So close your eyes. See if I can do it. 1, 1,000. 2, 1,000. 3, 1,000. 4, 1,000. Make sure you're in a safe place. A lot of times I tell people to go into a door frame so that they can touch. But you want to be able to do this 10 seconds without touching anything. It doesn't matter how much you waver or wobble. Can you come back to the center and hold your balance? I was able to talk and do it. So that was actually pretty good. So just consider another source to your knee pain. Just because you feel it in the knees, it does not mean that the knees are the source of your pain. So look at the ankle, look at the hips, and look at your ability to balance yourself, whether it's your vision or your vestibular system. Again, I'm Stephanie Carter-Kelly, a yoga physical therapist. Have a great rest of your day. Namaste.